recording, and you can start whenever you're ready.
Well, hi, everybody. Thank you so much for being here today. We're going to talk about understanding intergenerational trauma and exploring patterns from a family systems lens. I am Dr. Rachel Jacoby. I am a visiting professor at Palo Alto University. I'm also the president-elect for the Association of Child and Adolescent Counseling. Although I work in Palo Alto, I live in Ohio. So I'm a licensed professional clinical counselor supervisor in Ohio and a national certified counselor and a certified family life educator. Clinically, my background is predominantly working with children and adolescents, and from that context, we work with families as well. And I'm going to pass it over to Jackie, who's my co-presenter, to share a little bit about herself.
Hi, everybody. I'm Jackie. I'm a student in counseling at Palo Alto University, and I'm also the co-chair of the Latinx Task Force at Palo Alto University. And I have 1 year of experience working with children, with adults, with couples, with many people who have experienced trauma and have passed down the trauma to new generations. So I'm excited to be here talking about this topic.
So our learning objectives today are that we will be able to define what intergenerational trauma is. We also hope that you will be able to apply at least 2 theories and family systems to your work with clients who have experienced intergenerational trauma. And then we also want you to be able to identify at least 3 influences for intergenerational trauma. Now, Jackie and I have lots of content on these slides, and we would be happy to share these slides with you at the end of our PowerPoint presentation. But we just want you to know that even though we're going to be talking on the slides, we're also going to deviate a little bit as well, just so that way you can have the most full content from our presentation. So Jackie, I'm going to pass it back to you.
So what is trauma? Trauma is the body's response to an overwhelming event that exceeds our capacity to cope. And it can be the response to a single incident, or it can be the response to multiple or repetitive events. And trauma affects each person differently. Some people will develop PTSD, but not everybody will. Some others will have different symptoms. Complex trauma is when there are many incidents or the experiences last a long time, and it's normally during key developmental times and are often caused by parents or caregivers. I will use parents and caregivers interchangeably during the presentation, but so I refer to either one when I say either one of them. So exposure to these experiences can affect people in many ways, including decreasing self-awareness, emotional regulation, social emotional processing, and also processing of information related to the self and how we perceive the world around us. And some of the long-term effects are psychiatric disorders, and not just PTSD, also depression, anxiety, personality disorders, substance abuse. And so we're going to tell you a little bit about ACEs. ACEs are adverse childhood experiences, and these are events that happen during childhood and have long-lasting effects. All children need to be safe, need to feel safe, and have a stable and loving environment. And ACEs are experiences that will cause stress and will disrupt this. And they can cause trauma, they can affect the child's development. And some of the ACEs are going to include abuse, physical, emotional, and sexual abuse, neglect, domestic violence, exposure to substance abuse by somebody in the household, mental illness in somebody in the household, parental separation, divorce, criminal household member, or incarceration. And having multiple ACEs will increase the risk of developing chronic illness like autoimmune disorders, diabetes, and also mental health disorders and substance abuse. So when the parents have PTSD or depression or anxiety, which could have been caused by by ACEs they experience as kids, then this is an adverse childhood experience for their kids, which increases the kids' risk for mental illness.
So when talking about ACEs, we have to connect it to trauma. And so it's important for us to recognize the different treatment modalities for treating trauma. Historically, we would use tools like cognitive or trauma-focused cognitive behavioral therapy, which I love. The trainings that I've been to on TFCBT, I take away so many tools from them. We also want to use tools like mindfulness and meditation techniques when we teach ourselves to be mindful, or when we use mindfulness into our treatment of trauma, we're able to connect to our body, which leads to mind-body connection. So instead of seeing physical symptoms, we see physical symptoms as more of like distress, and some also become very, like, our symptoms become just distrustful of our bodies if we are having physical or somatic symptoms. I love integrating progressive muscle relaxation into my clinical work when I'm treating trauma, because it helps us have that mind-body connection. Other tools that we would have include like play therapy or sand tray therapy. I think play therapy is one of the greatest resources that we can give clients, for children and families. And the reason that I say that is because we're meeting kids where they're at, and we're allowing play to be their way of communicating their world to us. And sand tray therapy is great for children and adults. But I've also used sand tray and sand play with whole families. So that way we can have visual representation of how our families are, how we're perceiving our families to be. Other tools include parent-child interaction therapy or child-parent relationship therapy. Both help strengthen those dynamics within the family system. And then lastly, we have narrative approaches, and telling your story, telling what your trauma has been, is so valuable when you feel that space and that comfort to talk about what your story is. I love using trauma narratives in so many different modes. I've had clients write songs about their trauma through story. I love it when people use PowerPoints, maybe because I'm a PowerPoint kind of person, but I've had clients like create their whole PowerPoints of their lives for me, just to express their trauma. And so that all falls into that trauma narrative world. But it's also important that we attune to our skill set that we have as counselors or helping professionals when treating trauma. First off, listening skills is one of the most valuable things that we can offer our clients. I remember when I was in my undergraduate program, there was a course that, we had, it was a brand new course the year I took it, called the Listening Post. And in that course, it taught you literally how to be an active listener. What students did, they articulated, we are not trained professionals, we are just learning to listen. And so what students did was they put camping chairs in their university, the university student union, because that was a high influx of people passing through at our university. And we just sit and listen to anyone who sat down in our chairs across from us. As counselors and helping professionals, we are literally trained to be active listeners and to process content. And so we want to make sure that we're attuning to that skill set that we hold of when treating trauma. Another skill set that we don't want to dismiss is empathy, and attending to the clients that we have with empathy, and using paraphrasing to make sure that they understand that we are here and we are listening and we can recall what they're saying and we can be present with them in the moment. We also want to pay attention to our invitational nonverbal skills. When training clients, or not clients, when training counselors, I often make sure that their body language is speaking with them, as we should be. I even confront my clients with their body language. So I make sure that, if their arms are crossed, I know that they're feeling a little closed off in that moment. Or if they're looking out to a distance, depending on cultural considerations when discussing our topic, we attune to how our eyes and making eye contact might influence what they're sharing or how they're feeling while they're sharing it. We want to make sure our nonverbals make sure that we demonstrate that we are open and we are present in the moment. We also want to consider the types of questions that we ask. We want open questions, open-ended questions, closed questions. We want to have a limited use of why questions. I must have taken out the word why by accident in that statement on the PowerPoint, so my apologies. And we want to be mindful that we do not risk re-traumatization by putting pressure onto our clients or by doing something that's out of our scope of practice or insinuates implicit bias. Our clients aren't going to feel open to us, especially in a family setting, if they feel like we are picking sides or if we are putting or projecting our point of view onto them. So, let's see if I can click this button. So Jackie, I'm passing it back to you.
So intergenerational trauma happens when a person in one generation experiences trauma and the trauma is not resolved. So the person does not heal from that experience and the trauma will be passed down to the next generation. When parents experience trauma, either the symptoms that the parents or either the symptoms that they have, or sometimes the way they cope with the symptoms, for example, not being emotionally available because of their experience, or by minimizing or denying the trauma, then this can make it harder to acknowledge their kids' experience, and it will have an effect on their kids. And this can happen in several ways. So by repeating patterns of maltreatment or abuse. Sometimes when the caregivers experienced physical abuse as kids, sometimes they will repeat the same experiences with their kids, and they will abuse their kids because that's what they learn and that's how they were raised. And sometimes it's by mirroring behaviors. When caregivers are minimizing their emotions, the kids may do the same thing. By lack of emotionally available caregiver, if the parents are not emotionally available because of their own trauma, it will have an effect on their kids. And it will affect their attachment, and it will have long-term effects as well. We'll talk more about how this happens later. And for all these, there's a correlation between parents' exposure to ACEs and the presence of behavioral problems in their children.
So one thing to note with intergenerational trauma is that you're also probably going to hear the term transgenerational trauma as well. I will tell you that these two terms are interchangeable, often interchangeable. My understanding based on the research that Jackie and I have compiled is that the big difference between the two is that intergenerational trauma kind of looks from the lens of the child, even though it's still impacting all the different generations that have been influenced from the family. And then transgenerational trauma, this is like a tongue twister, typically comes from that lens of the parent projecting onto the child. Again, the two are used synonymously and interchangeably. So that's something that I would just encourage you to take note of. Now, one of my favorite theories is the ecological systems theory. I will preach this theory till I'm blue in the face. And the reason that I love this theory so much is because it just makes sense to me, where we have this mindset that different systems impact one another. Now, I will tell you that the ecological systems theory isn't technically a family systems theory or family systems application, but it can definitely be applied to family dynamics. And so that's why we included it into this presentation. So if you're not familiar with the family system, or not the family systems theory, now I'm jumping ahead, the ecological systems theory, this model was created by Uri Bronfenbrenner. And in the model, we start with the child. And so you can see my mouse kind of hovering over the child in the center. And then we have our microsystems. So our microsystems refers to the institutions and groups that most immediately and directly impact the child's development, including family, schools, religious institutions, neighbors, and neighborhood and peers. And then we go into our mesosystem. So our mesosystem consists of interconnections between the microsystems. So for example, between the family and teachers, or between the child's peers and the family. Then we have our exosystem. And so the exosystem involves links between social settings that do not involve the child. So for example, a child's experience at home may be influenced by their parents' experiences at work. If a parent has a really bad day at work and they come home and project it onto the child at home, then the child might have a bad day at home then, and continuing the cycle. A parent might receive, and on the alternative, a parent might receive a promotion that requires like more travel, which in turn increases conflict with the other parent, resulting in changes in their patterns of interaction with the child. And one parent might be more involved than the other parent. So that was the exosystem. Then we go into the macro system, and this describes the overarching culture that influences the developing child, as well as the microsystems and mesosystems that are embedded in those cultures. So cultural context can differ based on the geographic location, socioeconomic status, and poverty and ethnicity of the child and the family. And members of a cultural group often share a common identity or heritage or value. Macro systems evolve across time from generation to generation. And then lastly, we have the chronosystem. I hope you can see my mouse hovering over it because I'm a little bit blocked with seeing you guys as participants, but I want to see everyone. And so the chronosystem consists of the pattern of environmental events and transitions over the life course, as well as changing socio-historical circumstances. So for example, researchers have found that the negative effects of divorce on children often peak in their first year after the divorce. And by 2 years after the divorce, family interactions are less chaotic and more stable. An example of changing socio-historical circumstances is the increase in opportunities for women to pursue a career during like the last 30 years. However, we also know that current events might also influence that socio-historical circumstance that we are experiencing. And it might teach individuals to be more like advocates or to take a step back depending on their stances on what's going on in the world around them. Excuse me. So there are some key terms that I would like to address as well. I'm going to take a sip of water. Talking too fast in presentations always do that to me. So within family systems, some key terms to address, and these kind of hover across all different worlds and avenues of family theory, include subsystems. And a subsystem is a connected system to the larger system. So we have a family unit, and parents might be a subsystem, or children might be a subsystem. And then we have boundaries. Excuse me. The boundaries are the roles subsystems play within each other and how we set certain limitations or roles and regulations within in a family dynamic. Then we have triangulation, and triangulation is when a third person intervenes in a conflict or stressful relationship within a family. So if Jackie, Jordan, and I are a family dynamic, and Jackie and Jordan are siblings, and they decide that they're going to get into a fight, as their parent, if I intervene or take a side, I would be part of that triangulation. Jordan, sorry to throw you into our presentation that way. And then we also have second order cybernetics. And second order cybernetics is a philosophy that asserts that counselors are non-experts whose role is to co-construct meaning and solution within the family and places the problem outside of the individual. So we want to look at this from a whole family lens. And then the last one written on here is circular causality. And circular causality encourages thinking that has us asked to take other contexts and players. Excuse me. It's allergy season in Ohio, and it's hitting me hard today. And circular causality expands our scope beyond a specific issue. So the example I have up here for you is circular causality. So the son behaves, or a parent ignores our son. The son misbehaves. The parents pay more attention to their son, and the son behaves better. So we encourage how we can see a specific issue kind of change effects based on what's going on in the family dynamic. The last one I want to share with you, the last keyword I want to share with you, which we don't actually have on here, but it's a skill that you use within family systems, is creating a genogram or family map. Depending on the mode of family systems or family therapy you use, that word's going to change. But a genogram is developing this family history and creating it into this nice little map of who has what role in the family. I'm sure many of you have seen genograms. It goes through different generations. And on a genogram, I was trying to find like a really creative one. Like I found Harry Potter's genogram, but it just didn't make sense to use in the presentation because they expanded it so many different ways. But in the genograms, you can assert for patterns in family history. So for example, if alcohol abuse is a pattern, you would label that within the genogram. Same with any triangulation that took place, or any pattern you can really think of, it's all within that. And so we use that more as a history collection and a map within family systems work. And so, oh, excuse me. And so I also want to consider theoretical applications within considerations for family system work. So while trauma treatment typically treats the symptomatic individual, a family system approach examines the family's response to the traumatic events. So we look at how the whole family functions to the trauma. For example, a divorce is a trauma. There's no question about it. However, divorce is going to impact every member of the family differently. A family might come to counseling for family counseling, even if parents have gotten divorced, solely so that way they can learn how to function together as co-parents and as within a new lens in the family dynamics, because there's still a family whether the parents are married or not. And so if you're treating the trauma of divorce, you're going to look at how each child responds to the divorce, how each parent has responded to the divorce, how the parents might project onto each other or their children, how the children might project onto each individual family member. But we're treating the trauma of divorce as a whole. We also want to consider that family systems explains behavioral patterns within each family member. We're encouraging the family to look at this holistic lens of these are the events that each individual has experienced, but each individual is going to experience them in their own unique way. And so if a child is demonstrating negative grades at school when they were a straight A student prior to the divorce, that's their response to the trauma, and it's projected within the system as well, because then the parents might be mad at their child who is a straight A student. Then we want to also make sure that we're engaging family members to help them support each other. We don't want this to be you fix this person and we're just going to kind of watch mentality. And I got to tell you, I've had it happen in family counseling before, where I have had a family session and parents come in and they just try to place blame on one individual or another. It doesn't work like that. As a family counselor, you want to be mindful that you are being intentional to not create this room of hostility or allowing the individuals within the family to create this space of hostility. This is a space of learning and how to be cohesive with each other. And so we want to make sure that we can reframe that mindset to engage family members to support one another rather than to scapegoat one another. It also promotes healthy family functioning to avoid sending individuals back into this dysfunctional environment. Dysfunction is inevitable within family systems. It just happens. At least at one point or another, someone in the family is going to feel low. And I'm going to say the word low rather than anything else because that's the most fitting for a holistic description of it. And so when we are working with our families, we want to make sure that we're promoting positive family functioning, even if we know that the family system might be separating, or if we're exploring this long history of trauma that has impacted the family to be who they are or where they are at now. We want to still promote healthy strategies so that way they can navigate the world around them to not feel like they are in constant dysfunction or to send an individual into constant dysfunction. We also want to be able to reframe the problem and reduce blame. That's so important. I've worked with families where they come in and they blame one person, typically the child, because again, I work with children and adolescents predominantly. And so I've had families come in and say, she's just, this child is just horrible. They're so mean. They're constantly talking back, and it's really causing tension within the family dynamic. And reframing the problem to be, well, maybe it's not that they're, talking back, but maybe they're trying to ask for your attention. And when their way of noticing that you give them attention is by acting negatively. And so rather than giving them negative attention, why don't we reframe this to be, okay, we know that we need to intentionally set time up to give our all to our child. And when we can't give our all to our child, we need to at least verbalize, like, listen, I am here. I am doing what you need me to do. I am listening. I'm going to give you what I can give you. But how can I give you what I can give you while also respecting the boundaries that we need to set? So that way you understand that sometimes I might need to step away from myself. That allows us to reduce blame. It also eliminates new traumas that the child might start to accrue because they feel like they're not getting the attention that they need. And then lastly, in our world of theoretical application so far, we want to create some homeostasis within the family dynamics. We want to create a new balance, redefine how the family functions. And so that might be through communication. That might be through family mapping in your office, or family sculpting, or just seeing what the genogram patterns might bring up for you. So let's create a new balance for our family so that way we're not living in this constant state of trauma or turmoil.
So I'm going to tell you a little bit about one of the family systems theories. Bowen's intergenerational theory is one that will help us see those patterns that happen between generations. And he saw the family as an emotional system. He believed that chronic anxiety, and not anxiety as a diagnosis, but rather like stress, normally as a response to a crisis or conflict, moved from one person to another throughout the system. And he believed that the system had a huge impact on each person's emotions, behaviors, and symptoms. So this theory will help us understand the family in a multi-generational framework. And some of the core concepts of Bowenian theory are differentiation of self, which refers to finding a balance between individuality and togetherness. These are two forces that are going to push us and pull us towards and away from each other. And we need to, because we need to feel close to each other, and we also want autonomy. So more differentiation means that we are better able to self-regulate. And when there's stress in the family, we can tolerate emotions and respond instead of reacting. When there is less differentiation, we tend to react more. When parents are able to self-regulate, because there's more differentiation, they can help co-regulate their kids. And with trauma, there tends to be less differentiation. So a mom who experienced trauma will have difficulty self-regulating and then co-regulating their kids, and their kids will have less differentiation and a difficult time regulating their emotions. So when there isn't, and Bowen, when there's not enough differentiation, Bowen called it an undifferentiated ego mass. So another concept is family projection process, which is when the parents or caregivers will transmit their emotional problems to their kids by projecting their anxiety. And this will also decrease differentiation. Another concept is the multi-generational transmission process, and emotional processes are going to be transmitted from one generation to the next. And children may have higher or lower levels of differentiation, or sometimes equal. And the more differentiation, the fewer emotional problems, and the less differentiation, the more emotional problems. So families that have a lot of emotional problems, it's normally because throughout the generations, the differentiation became lower and lower. And this will continue to affect new generations until somebody stops the cycle and deals with what is happening. So we will see this with trauma. Another concept is emotional triangles, and Rachel talked a little earlier about triangulation, but emotional triangles are building blocks. So triangles are stable, they're a stable structure, while a dyad is not very stable, a triangle is. So triangulation occurs when the dyad brings a third person to stabilize the structure and relieve the tension. And the problem is when this structure becomes rigid, and then this will perpetuate the problems. And then another concept is a sibling position. There are certain characteristics that are expected based on the sibling position, birth order, and this is normally an indication of differentiation. When there are higher levels of differentiation, the siblings tend to have more of the characteristics that are expected of them. Emotional cutoffs is when there are low levels of differentiation, and we may physically or emotionally cut off to relieve anxiety because we need that distance to feel safer. And so this will happen when we cannot tolerate the emotions. And sometimes an emotional cutoff may seem as if the person is more differentiated, when in reality, the person is just distancing themselves to be able to cope. So in therapy, we need to assess multi-generational patterns by focusing on processes rather than content. And Rachel explained what a genogram is. It's a tool that will be used to explore history, patterns, structure, differentiation, how families handle stress, anxiety, how the anxiety moves through the family, triangulation. And I also love genograms. I use genograms all the time. I use them with adults, with families, with kids. Something that is really fun is to do play genograms. So with kids, just using a big piece of paper, you can kind of draw the genogram, and they can use different toys to put to represent each person, and they can even use toys to represent the relationship between two people. And there's so much that you can learn, that you can understand about the kid or the family reality and about their experience. And it's also very insightful for them sometimes. So I think it's super helpful to see what is really happening in the family. And the goals of treatment in Boyonian therapy are increasing levels of differentiation and decreasing emotional reactivity. So, and then another theory that can be used is Satyr's growth model. Satyr's growth model is a humanistic existential model, and like all humanistic existential models, will focus on emotions. And she talks about 5 communication stances. When we feel threatened, we normally take one of these communication stances, and 4 of these are survival stances, and we learn them normally in our families of origin. We will either learn them from a family member who has the same survival stance, so it may be just by copying what they are doing, and sometimes it's a complementary style. And I will explain this a little later. So, for example, one of them, for example, is a placater. So the placater will ignore the thoughts and feelings and focus of others, of themselves, and they will focus on the thoughts and feelings of others. So they will try to please others all the time. And a blamer is going to focus on their own thoughts and feelings and ignore others. So sometimes the placater and the blamer are going to complement each other, because if the parent is blamer, then the child may be placater, because they still have that need to please their parents, to feel that they have their parent close, that they're being loved. So if they are both blamer, there's going to be a lot of conflict. So which can happen, but many times the child will be placated just because they want to have a good relationship and they are looking for their parents' approval. Super reasonable will focus on the context, but will deny their own thoughts and feelings and the thoughts and feelings of others. So it will be very logical, almost like a robot. And irrelevant will distract. And when especially when this person is under stress. So it won't acknowledge the self, the feelings or thoughts of themselves, the thoughts or feelings of others, or the context, and it will avoid what's happening. So you can see this in the class clown, for example. And congruent, that you can see here in the center, is when we can acknowledge what we are thinking, what we are feeling, as well as what the other person is thinking and feeling. And the communication is also appropriate to the context. So ideally, we all want to have a congruent communication style. So when we're working with the whole family, we can see how they are interacting. We can see each person's roles. For example, one person may play the role of the victim or the bad child or the rescuer, and the expectations they have of each other. And what will cause dysfunction is that when we are, dysfunction is going to be caused by the unrealistic expectations that we have of each other, and by taking inappropriate roles, and by faulty communication styles. So using the communication styles, not congruent communication style, but by being more a placater or a blamer, it will increase dysfunctional relationships. And dysfunctional, well, the symptom has a role in the family. So we need to understand how the symptom makes sense. And some of the family dynamics that can cause the symptoms are, for example, conflict between the parents or lack of emotional validation. And dysfunctional family systems are going to cause low self-esteem and problem behaviors. So one of the goals of therapy are going to be increasing self-esteem, achieving congruent communication styles as much as possible, and helping the family become more functional by transforming dysfunctional patterns. And this is done through the 6-stage model of change. So first, there's assessing the status quo, which is figuring out who is the symptom bearer, try to figure out who is, well, I mean, it's the identified client, so it will be the person who normally comes to therapy if it's individual therapy, but when you're working with the family, you want to see who is a symptom bearer. Then a foreign element will be introduced, and it could be a crisis, but also in therapy, it could be the therapist who is introducing an intervention, for example, and this will be the foreign element. And then there's chaos, and the foreign element will cause a positive feedback loop. There will be change, but eventually the family is going to reintegrate. They're going to think of new possibilities, and through a trial and error, they will develop new interaction patterns, and there will be a new status quo, which will create homeostasis. Yeah.
So when working with families as well, you want to make sure that you attune to clinical and cultural considerations. And so one of the first things that I would like to acknowledge is the law of cultural differentiation. So the law of cultural differentiation, it's our human ability for us to acknowledge that cultural factors prescribe what we learn and how we function, and how we kind of acknowledge the world around us, is what I'm trying to say. So the perks is that we recognize how we are uniquely individual based on our cultural influences. The barriers are that it leads to this difference in patterns of our abilities because of what our culture has influenced us to do, or how we've been socialized because of our culture. And so with that, we want to make sure that we attune to recognizing the socioeconomic, racial, religious, gender, sexual orientation, and ethnic considerations that our clients bring to the table, but also what we bring to the table. So For example, I have lots of clients and families that come to see me that are different than who I am, and that's okay. We're all supposed to be different, but we want to acknowledge that our differences might influence my understanding of how the family functions. Even within our own family systems, you know, my family is very, very different than how my spouse's family functions. And so recognizing, you know, how that how that might influence how my spouse and I interact as a unit will be important for any counselor that we see to consider. It's also important for our counselors, or as counselors or helping professionals who work with family systems, to account for what our differences are and how we can still learn about the culture or experiences that have influenced or continue to influence our clients, our families that we work with, and their overall functioning or how they are structured as a family system. The other thing that I want to acknowledge is know what's in your scope of practice. Now, I say that and I want you to hear it over and over and over again within your head. What is within my scope of practice? I know a lot of counselors who are really skilled as individual counselors, but they have very minimal experience working with family systems or family work. And although we as counselors are trained to work with the whole gambit of individuals, we might not feel competent in working with individuals who are coming with their whole family. And so I would encourage you to work within your scope, right? Work within what you are trained to be doing. If you are trained as a counselor to work with, I don't know, children, but you're not trained to have an actual family session, then you don't do that. You will work with the parents individually, you work with the child individually, or you can have a couple joint sessions where you communicate some skills, but you're not necessarily doing family systems work. Same with if you're working with adults. It's just vice versa. You're not going to necessarily work outside of your scope of practice. I would highly, highly, highly encourage any individual who wants to work with families, which again, families influence every client that we're going to see. So keep that in mind. But I would encourage you to continuously get education on family systems work and how to use the tools within the family systems world. So for example, Jackie and I have both been trained heavily on using genograms. And so we can use genograms within our practice, but it would be inappropriate for me to tell one of my supervisees to use a genogram if they haven't been trained to do so or to create one. Although genograms are very easy to create. Same with like family sculpting. So for those of you who don't know, family sculpting is a tool, and what you do is you physically, one person in the family physically moves other family members to be like statues, in how they visualize them. So for example, if I throw Jordan and Jackie under the bus again, if I am the parent and I want to sculpt our family, I might choose to have Jackie with her arms like this and her back towards Jordan, and I might have Jordan like tapping on Jackie's shoulder because maybe Jordan's trying to crave Jackie's attention and Jackie doesn't see that and she wants to close Jordan off. And then I would sculpt myself into this, and I might be like pulling my hair because as a parent, I'm trying to get my children to work together, to see eye to eye, to get along. And I feel like I can't do that. And so if you use a tool like that, you want to make sure that you have the competence to do so. So before Jackie and I conclude our presentation and open it up for conversation, we have a little case study for you. We were originally going to do a case study for both of Satir and Boinian, but we realized we don't have time for that. And so we have this case and you can apply it as such. The case is the Smith family. So meet the Smith family. We have Bob, 45, Karen, 44, Alex, 14, female, Max, 11, male, and Drew, 7, female. The Smiths are coming to counseling due to conflicts amongst all members of the family. Karen states that Bob is highly reactive to all members in the family and has been emotionally distant from her. She blames his high reaction on his alcohol use, which she considers excessive. This has led her to be more focused on the children and experience an increase in her own anxiety. Alex claims that her mother is overbearing. Max claims that he hates the family fights. And Drew states that she feels safest in her room with her stuffed animals. After gathering a family history of the family, you learn that Bob grew up in a home where his father was highly reactive as well. Bob claims that his mother drank daily and that he never saw them express any compassion for each other. Often his parents would get into physical fights, leaving Bob feeling scared and alone. Karen states that she grew up in a similar home environment. She wants her children to feel safe and loved, unlike she did as a child. So, and I would love for you guys to unmute yourself or raise your hand if that's easier, but what would your steps be with working with this family? What are your thoughts? I'm going to open the chat too to see. Oh, that's Jordan.
I think maybe, Rachel, individuals might be having a little bit of trouble is because there's a lot of different dynamics going on at the same time. So I know for me, it's hard to figure out, like, what do you pinpoint first? Like, what is the main emotion that you have to pull from first? So maybe can you talk a little bit about when there is like 4 or 5 different family members, what would be the best to go from first, instead of like diving right into how Bob's mother drank daily?
Yeah. So in this is a very open case study here that we got going on. For meeting individuals, typically within family therapy to explore intergenerational patterns, you actually might have individual sessions with each family member, and that allows you to gather a really thorough family history. And then also making sure that you are kind of seeing what each family member needs individually from the whole family scope. Does that make sense? I hope that answers your question, Jordan.
Yes, it does. And Joey put in the chat, they love the sculpting technique. Would this be effective here, or recommending Al-Anon or AA along with family therapy?
The family sculpting technique would definitely be appropriate here. So we're collecting a genogram, and in that genogram, you would want to explore the family patterns, because we see that there's a history of abuse, whether it's emotional or physical. We would need to gather that information a little bit more. We see that there is a history of alcohol use, and we also see that there's a history of lack of like demonstration of compassion and empathy amongst family members. And so all of those we will want to identify within our genogram, our family map. AA or Al-Anon, it depends. We would want to gather more information on the family and on Bob's use, because although Karen might perceive Bob's use of alcohol to be excessive, it might not be excessive to the point where Bob feels that way. Now, that is an individual assumption and perception, and it's based on what the family identifies as a whole on what they need. Erica, I see your hand went up. You are welcome to unmute yourself.
Yes, hi, my name is Erica, and I think also I was reading through this again to see if there was any like cultural reference to like where the backgrounds might be. I think also addressing that and seeing how their culture could also affect, maybe like some of the alcohol use, some of the behaviors we see as well. And that's something that I would also bring up as well.
Yeah, culture isn't identified in here, and you made that catch. I'm very impressed by that. So good job. You're right. All of that might influence how this family is communicating or cohabitating. So great job, Erica. And Nicole, I see your hands up as well.
Yeah. Could you give the dad Bob an assessment about his alcohol intake?
You
As a
could.
means of discussing with him, of course, figuring out on the spectrum how bad it is.
Mhm. You could definitely do an alcohol assessment or a substance use assessment. Now, that would need to come into play a little bit more in that individual meeting that you might hold with Bob. However, if there is that does show up that he does have some sort of alcohol use or substance use disorder, it would be best to recommend that he has his own individual counselor. Now, as a family counselor, you're not doing individual sessions with everyone all the time because you are working with the whole family unit. Although we have to identify like one primary client, I blame it on insurance, but it is what it is. We're still working with the family as a holistic, whole cohesive family unit that needs to change. So if that was the case, it would be the recommendation that he still seek individual counseling for that disorder, that diagnosis as well. And
Can
support.
I ask a second question?
Oh, absolutely.
What did you say about Al-Anon? Because I'll tell you, as a person in recovery
Mhm.
and as a person with two parents who were practicing, well, who are alcoholics,
Mhm.
I can't highly enough recommend Al-Anon, at least for the rest of, from Karen all the way to Drew to get support, if only through commiseration with other people who are going through the same thing, and to understand a little bit more Bob's perspective from a kind of indirect angle.
First, I want to thank you for sharing that part of yourselves with this whole group. I really appreciate that authenticity. Al-Anon is a fantastic program. There's no question about that. It is a great resource for individuals who are in recovery and for their family members. It creates a sense of safety and home and education for all members. The barrier that we might face is that Bob might not be ready for Al-Anon. And so we might need to make sure that it definitely would be a great tool to use and a great recommendation from the counselor in this stance. But Bob also has to be willing to make that change and be ready to make that change. By recommending, like, here's this resource, listen to what it can give you if you use it the right way. That is what the recommendation should be.
Actually, I think they can go to Al-Anon whether he's drinking or not.
Yeah, no, I agree with you. Yes, they can. I'm saying Bob, though, might need to be ready for himself to go.
Well, Bob would go to AA, not Al-Anon.
Yep.
Okay.
Yep, correct.
Thank you.
Of course. I see some other comments in the chat, so I'm going to attend to them. Since there is a history of alcoholism in the father's family and possible codependence in the mother's family, it would be good to explore if any of the children are using alcohol, especially Alex. Absolutely. And also, I would say Max would also fall into that age range. We would be surprised to find out how many 11-year-olds are actually using substance or how much access they have to substance. So thank you for that point, Linda. And then yes, Smith is I gave like the most basic names on this case study because I wanted to be very generic. Hannah says, who would you identify as the primary client here? That's a great question, Hannah. And I think it depends on what more content you find. In this scope of this case study, I would identify Bob to be the client. But I think it just depends on how much more context is available to the family at the intake of family therapy. In my stance, I believe Bob would be the client, and then the family system is there to support him.
Would it be wrong to think, because I know maybe we all have different ways that we learn about family systems, Rachel, but when I think of like family therapy or like couples therapy, it's really hard to like isolate which one is like the client, because I've learned that like the whole unit is your client. And I found that in sessions where I like isolate one or the other, they'd come back and be like, hey, I really felt like you weren't on my side then, and you were sort of like attacking me. So that's sort of where I was coming from when I was talking to Hannah in the chat, is like when we isolate one client as being the problem and then the whole family is like, yeah, dad's the problem, it's really hard for you as the therapist to try and make the whole unit as, work as a whole, because we're just, focusing on dad. So that's sort of where I was coming from. So maybe that might be wrong in terms of how I thought about it, but I don't know.
You're 100% correct. As you might have words are hard. As you might remember from my previous statement, although we identify typically one client, we're not working with just that one client, we're working with the whole system. And so that's what the lens that we do want to work on this with. Although we're exploring Bob's reactivity, we're also exploring Karen's needs, we're exploring Alex's needs and Mac's needs and Drew's needs, and how they can create cohesion within the family system. So you're absolutely right, Jordan. I see, is the client usually the one? Yeah, that's why we identify an individual client is for that label for insurance is my stance. Okay, well, I note that we have about two more minutes left before we have to conclude. I just want to account for, is there any other questions that people might have before we conclude our time together today? I see a lot of comments in the chat, so I'm trying to keep up with them. Another step to take would be within the family to learn about their current coping skills. Absolutely, Erica. Well, I would like to thank you all for being here today with myself and Jackie. You guys have been wonderful, and I appreciate your involvement in our case.